Hello, and welcome to Anatomy with John and Scully. Today we'll be talking about the multifidus muscle, going over origin, insertion, action, innervation, and blood supply. Thank you for joining. Alrighty, so multifidus. Starting with the origin. It's going to originate on the sacrum, the ilium, the transverse processes of T1 to T12, so let's count up. So 5, 4, 3, 2, 1. Here's T12. There's the transverse process, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. As well as the articular processes of C7 to C4. So here's C7 articular process, 6, 5, and 4. It's going to insert onto the spinous process above and the corresponding 2 to 4 spinous processes. So in the lumbar area, it's going to be here on S1, but it can also go to L4, L3, and L2. So kind of doing this. It's going to receive its innervation from the dorsal rami of each region. And its action is going to be to stabilize the spine. Blood supply. Let's start in the upper spine levels. So we're on the right side, so we're going to have the brachiocephalic trunk coming up. That's going to give off the common carotid, which is coming up through here, at about the level of C3-4, so 1, 2, 3, 4. We're going to bifurcate into the external and internal carotid arteries. We're going to follow the external. Behind the mandible here, at about the level of C2, we are going to give off the occipital artery, which is going to supply blood supply to the multifidus. Coming back down, we're going to go to the subclavian artery now. Subclavian artery is going to give off the vertebral artery, which is actually on our model here. Vertebral artery through the transverse foramina is also going to supply the multifidus. Then lastly, from the subclavian, we're going to get the exit of the costo-cervical trunk, which is going to travel posteriorly and superiorly. Once it gets to the posterior aspect of the first rib, it's going to turn into the deep cervical artery, which is going to travel, ascend up, which is also going to supply multifidus. Looking at the thoracic portion, the thoracic aorta is going to give off posterior intercostal arteries. Okay, the posterior intercostal artery is going to bifurcate just past the head of the rib and give off the dorsal branches of the posterior intercostal artery. That's also going to supply multifidus. We also have the subcostal artery, which is coming off of T12, so let's count up. 5, 4, 3, 2, 1. There's T12. So at T12, we'll get an exit on either side of the subcostal artery, which is going to travel along the 12th rib to supply blood supply to the multifidus. Lastly, we're also going to have the abdominal aorta giving off the lumbar arteries, which is also going to supply multifidus. And then it's also going to have blood supply at the sacrum. So if we have the aorta bifurcating at about the level of L4 into the common iliac arteries, we're going to follow the common iliac artery. It's going to give off the internal iliac artery around the level of the sacrum. And that's going to give off a branch called the lateral sacral artery, which is going to dive into the sacral foramina, go dorsally to supply multifidus through the dorsal branches of the lateral sacral arteries. So there you have it. Origin, insertion, action, innervation, and blood supply of the multifidus muscle. As always, do not forget your leafy greens, and go Raptors. Take care, folks.